Family home visiting is not a one-size-fits-all program. It is different for every family because every family has different needs. It's a wide variety of programs that we get to offer to families. Things that we can offer are prenatal support, breastfeeding support, infant feeding support, monitoring growth and development of their baby. We offer parenting support, finding out how things are going for them, what they're struggling with, if they're inclined to share with us. We can help them find resources that they need. We can help them get car seats for their children if they're in need of a car seat. We talk about safe sleep, and if a family doesn't have a bed for their baby, we have a program that can help them obtain a safe sleep area for no cost. Our main goals are to have healthy families in our community and to help parents feel prepared for and confident throughout their child's early years. A lot of people don't have transportation, or perhaps their transportation isn't reliable. They live far from their clinics at times. Maybe they don't have any family or friends nearby. So this is a service that can come to them. We get referrals from WIC oftentimes. WIC is a federal program put on by the Department of Agriculture, and it works with young families with children under the age of 5, and they can often find out about us through them. They can find out about us through the doctor's office. We want providers in our area to know that public health is here and that we provide services for families that they can really benefit from. Public health is here to fill a gap in healthcare for whatever age you are. The service is based on their needs, not what I think they need. The family identifies their needs, and we explore that through conversation. It's free, it's voluntary, there's no cost to the family to participate in these visits, and it can be really lots of fun.
We moved to this area, and I didn't know a lot of people. And I had just given birth, and he had his own medical issues, and I had postpartum, and so it was hard to get out of the house and meet new people, especially in such a small community. And it was nice to have that constant of them coming to the house and being there for me and being there for my kids and just showing me that kind of community and that kind of kindness. The things that have been most beneficial to us, other than the weigh-in, is I did struggle with my oldest child getting into doctor's appointments and stuff, and with my permission, they were able to advocate for me with doctor's appointments and help me navigate that. The second most beneficial thing for me, other than the interactions with my children and everything, was my own postpartum depression. I was very emotional and struggling, so we sat down and did a postpartum assessment. So I took action and I got the care that I needed, and a few months later, after continuous visits, they came back and did another postpartum assessment, and I had improved quite a bit. It was very nice to know that it's made a difference for me. I enjoyed the assessments because when I moved here, my daughter had never had an assessment, so I wasn't sure on the assessment side if she was going to start preschool, if she'd be up to par. And so that was super fulfilling for me to be able to do those with Sarah and know that my kids are on track, or if they're not, they give me handouts for activities that I can do to practice with them to get them on track. There's physical ones for, are they meeting their milestones for their age as far as like physical activity, strength, things like that. And then there's a social emotional one, and that is like, are they meeting their milestones for their social skills and their emotional well-being? As a person who doesn't always trust everyone or like to let people in, I think it's very beneficial that you do, because they can offer you a lot of information and advice, and they offer a lot of support. And sometimes as parents, I think we get caught up in thinking that we know what's best, and maybe we have more than one kid, and so we think we should know more by now. But it's nice to have someone there who has your back and who gives you information that you didn't even know you needed. I'm not sure I would have made it as well as I did here in the last year without Sarah. So I would say that if you are looking for the resources and the friendship and the community feeling, then you're definitely going to find it with them.